Good day, everyone. We are the group 4 and we are going to discuss about the personality disorders. We are the members of the group 4, Ahsan Aliuddin, Rikami Gomez, Norhaini Samporna, and Norhaifa Ismail. Personality disorders. Personality disorders will usually become noticeable in adolescence and continue into adulthood. You may find it hard to build and maintain relationships, and you may struggle to work with other people effectively. Living with a personality disorder can leave you fearing other people. This can often lead to social isolation and leave you feeling alienated from others. Yet, with the right support and information, you can begin to understand what you are going through. You can learn how to build relationships, understand others, cope with your feeling, and live a fulfilling life. A personality disorder can show itself in different ways. There are currently 10 known types of personality disorder, which can be grouped into three clusters. The clusters A, B, and C. I am Norhaifa Ismail and I will be discussing the cluster E, which is the paranoid, schizoid, and schizotypal personality disorders. Paranoid personality disorder or PPD is one of a group of conditions called eccentric personality disorders. People with PPD suffer from paranoia and unrelenting mistrust and suspicion of others, even when there is no reason to be suspicious. And the exact cause of PPD is not known, but likely involves a combination of biological and psychological factors. The fact that PPD is more common in people who have close relatives with schizophrenia and delusional disorder, such as a genetic link between the two disorders, may run in the family. The psychotherapy and medication are most effective treatment for this disorder. Psychotherapy appears to be the most hopeful method of treatment for paranoid personality disorder. Sufferers of this disorder have deep-rooted issues that require intense therapy. And the next one is the schizoid personality disorder. When we say schizoid personality disorder is an uncommon condition in which people avoid social activities and consistently shy away from interaction with others. They also have a limited range of emotional expression. And the recommendation form of schizoid personality disorder treatment tends to be psychotherapy with a counselor or psychotherapist specializing in treating this condition. And the counseling. Goals of counseling for schizoid personality disorder tend to be solution focused to help individuals solve immediate problems and crises. And the cognitive behavioral therapy. Many therapists will employ cognitive restructuring exercises in schizoid personality disorder treatment, as this can help to address certain types of irrational thoughts that may be influencing the person's behavior. And the group therapy is a form of psychotherapy that involves one or more therapists working with several people at the same time. And the medication. The most common types of medication prescribed to individuals with schizoid personality disorder tend to be antidepressants, but stimulants may be given to provide a mental boost. Self-help techniques. It is generally thought that sufferers can significantly help themselves if they make an attempt to socialize. And the schizotypal personality disorder. People with schizotypal personality disorder have odd behavior, speech patterns, thoughts, and perceptions. Other people often describe them as a strange or eccentric. People who have this disorder may also dress, speak, or act in an odd or unusual way, be suspicious and paranoid. The causes of schizotypal personality disorder is still unknown. However, research has found increased occurrence of the disorder in relatives of schizophrenia. And some form of psychotherapy is usually the preferred choice of treatment of these disorders, as with most personality disorders.
Cluster B is called the dramatic, emotional, and erratic cluster. It includes borderline personality disorder, narcissistic personality disorder, histrionic personality disorder, and antisocial personality disorder. The antisocial personality disorder is characterized by a pervasive pattern of disregard for the rights of other people that often manifests as hostility and or aggression. This behavior may cause a problem in a relationship or at work. The cause of this disorder is unknown. A person's genes and often factors such as child abuse. Histrionic personality disorder. People with histrionic characterized by pattern of excessive emotionality and attention seeking. Their lives are full of drama, so-called the drama queens. They are uncomfortable in situations where they are not the center of attention. People with histrionic personality disorder have a distorted mental image of themselves. They base their self esteem on the approval of others. Narcissistic personality disorder. People with narcissistic personality disorder have significant problems with their sense of self worth stemming from a powerful sense of entitlement. This lead them to believe they deserve special treatment and so assume they have special powers, are uniquely talented, or that they are specially brilliant or attractive. Their sense of entitlement can lead them to act in ways that fundamentally and disrespect the worth of those around them. Narcissistic personality disorder causes problems in many areas of life, such as a relationship, in work, school, or financial affairs. People with narcissistic personality disorder may be generally unhappy and disappointed when they are not given the special favor or admiration they believe they deserve. And borderline personality disorder is one of the most widely studied personality disorders. People with borderline personality disorder tend to experience intense and unstable emotions and moods that can shift fairly quickly. They generally have a hard time calming down once they have become upset. The people with borderline personality disorder experience wide mood swings and they feel a great sense of instability and insecurity. Childhood trauma such as sexual, emotional, or physical abuse also may lead to the onset of the borderline personality disorder. Theories. According to biosocial theory, borderline personality disorder is developed by a biological predisposition to hyperarousal and hyperreactivity combined with an invalidating environment. Example: distorted and unstable self-image or sense of self, impulsive and often dangerous behaviors such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. Narcissism played an important role in Kohut's theory of self psychology. which suggested that narcissism was a normal and essential aspect of development and that difficulties with early self object relationships could lead to challenges in maintaining an adequate sense of self esteem later in life. Example, have an inability or unwillingness to recognize the needs and feelings of others, be envious of others, and believe others envy them. Cognitive behavioral theory. Antisocial personality disorder is a mental health condition in which a person has a long term pattern of manipulating, exploiting, or violating the rights of others. This behavior is often criminal. Example, people with an antisocial personality disorder don't follow societal norms, are deceitful and intimidating in relationships, and are inconsiderate of the rights of others. People with this type of personality may take part in criminal activity, but if they do, they are not sorry for their hurtful deeds. They can be impulsive, reckless, and sometimes violent. This disorder is far more common and more apparent in men and women. Clinical case, a borderline personality disorder. A 26 years old woman is brought to the emergency room by an anxious looking man who explains that she became angry and suicidal, stating that her life had no value and that she would like to end it all. After he criticized her, her history includes 5 previous emergency room visits involving self-inflicted cuts that require sutures and 2 psychiatric hospitalization after overdoses. Adolescence adjustment reaction and major depressive disorder have been diagnosed in the past. So, this case is interconnected as a borderline personality disorder because when we say borderline personality disorder, a person has unstable emotions like mag mag-decide siya orada-orada like for example naa siya sa angry mood, so in that situation mag-orada-orada pud siya og decide nga like maghikog ko or mag-suicide ko karon kay wala ko gi-crush back sa akong crush like that. Narcissistic personality disorder. Gina does not feel she has any problems other than not receiving the attention and recognition she feels she deserves. Her achievements are not commensurate with her desire to be worshipped and adored. Jenna feels she is entitled to special treatment, and when this failed to occur within her career or social life, she becomes explosive and stubborn. She has an excessive need for admiration as evidenced by her choice of careers. She seems to have no empathy regarding others. So, this case is interconnected siya sa narcissistic personality disorder because when we say narcissistic personality disorder, the person is nagaclaim sila og self-entitlement, and if they fail and they are not given the special favor or admiration they believe that they deserve, they will manipulate and violating the rights of others without any remorse. Like, buhato nila ang tanan, balag makasakit sila sa lain, balag ma-disrespect nila ang lain, basta ma-achieve nila tong ginatawag na self-entitlement na they believe that they really deserve it. Histrionic personality disorder. Marcia visibly resents the fact that I have had to pay attention to another patient at her expense, as she puts it. She pouts and bats suspiciously long eyelashes at me. Has any of your female patients fallen in love with you? She suddenly changes tack. I explained to her what is transference and countertransference in therapy. So, this case is interconnected siya sa histrionic personality disorder because when we say histrionic personality disorder, the person is attention seeker sila, which means ginabuhat nila ang ilang gusto para lang gyud makuha ang imong attention. So like sa case, di ba, iyang giakit ang doktor para lang gyud makuha ang attention nga gusto niya gikan sa doktor. Antisocial personality disorder. A 28 years male was seen by a psychiatrist Calcutta after getting into a fight with another inmate over a RS-10 bet. SP was brutally beaten up by wardens of the jail. The case history reveals that SP was jailed twice before for cheating case and for assaulting one friend. This time, SP was jailed for fighting with a police constable. During interrogation, SP admits that he has beaten the other inmate who refused to pay money. SP wanted to show his power and there was no remorse for his action. Family history showed his neglected childhood. Father left home at his age of 6 years, and his mother had an extramarital relationship with a neighbor. He failed twice in school examination and left school. He used to started smoking and drinking alcohol at early age. So this case is interconnected siya sa antisocial personality disorder because when we say anti-personality disorder, the person is aggressive or mapanakit sila, but that mapanakit side nila is maybe the reason kung ano sila ing ana, like sa iyang experience sa childhood experience nga kanang gibiyaan ko siyang papa, nagnasawa iyang mamaglain, then nagundang siya eskwela, so kana technique how to handle the disorder. Personality disorder are psychiatric disorders characterized by a chronic patterns of inner experience and behavior that are inflexible and present across a broad range of situations. Psychotherapy, also called talk therapy, is the main way to treat personality disorder, but it also needed medication from your doctors so that the treatment help you to learn skills, manage, and cope with your conditions.
So hello, I am Narhaini P. Samparna and I'm going to discuss on the topic Cluster C personality disorder. So before I started, I just want to remind you that we had understood that personality disorder have been categorized into three clusters. So in this my group members have already discussed what is cluster A and B. So let's see cluster C personality disorder in details. So, cluster C personality disorder are characterized by anxious, fearful thinking or behavior. So, when we say anxious means when you experiencing worry, unease, or nervousness, typically about an imminent event or something with an uncertain outcome. So they include cluster C personality disorder include avoidant personality disorder, dependent personality disorder, obsessive compulsive personality disorder. So let's see the sign and symptoms of personality disorder. Cluster C personality disorder. So a pattern of avoiding new activities or thinking personal risk for fear of embarrassing oneself, and then a strong fear of disapproval and rejection, a pattern of overthinking things and finding it difficult to make everyday decisions without a lot of reassurance. So, feeling an intense need to be taken care of or directed, an intense need for order, neatness, and control. And the last one is a pattern of being very focused in working and being productive. So, let's talk about causes. So, like all mental health issues, personality disorders are complicated. A mixture of biological and environmental factors can cause some people to develop a personality disorder. There is some evidence that suggests that genetic may play a role, but environment and life experience are also factors. So last one is people who experience trauma, abuse, or have unhealthy relationship as children are at a higher risk of developing personality disorder. So that is the cause. And then now let's see the treatment. So treatment, um, there are a variety of treatment available for personality disorders. For many people, a combination of treatment works best. So the treatment of this is that psychotherapy. So it involves talk therapy, group therapy, cognitive behavioral therapy, dialectical behavioral therapy, psychoanalytic therapy, and psychoeducation therapy. Psychoeducation therapy. So let's see the types of cluster C personality disorder, which is avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. So avoidant personality disorders is people with avoidant personality disorder experience shyness and unjustified fear of rejection. So they often feel lonely but avoid forming relationships outside of their immediate family. Other avoidant personality disorder traits include being overly sensitive to criticism and rejection, regularly feeling inferior or inadequate, and avoiding social activities or jobs that require working around other people, and then was and holding back from personal relationship. So the next one is dependent personality disorder. So excessive dependence depends on other and feeling the needs to be taken care of. Submissive, submissive or clingy behavior towards others, lack of self-confidence requiring excessive advice and reassurance from others to make even small decisions. So difficulty agreeing with others, fearing disapproval, difficulty starting or doing project on your own, tolerance of poor or abusive treatment even when other options are available, and then urgent need to start a new relationship when a close one has ended. So that's it, the dependent personality disorder. And the next is obsessive compulsive personality disorder. So preoccupation with details, order lines and rules, extreme perfectionism resulting in dysfunction and distress when perfection is not achieved, such as feeling unavailable to finish a project because you don't meet your own strict standards. So desire to be in control of people, tasks and situations, and inability to delegate tasks. Then neglect of friends and enjoyable activities because of excessive commitment to work or a project. And then flexible about morality, ethics, or values. Then tight, miserly control over budgeting and spending money. So that's all, and that's all for our groups. Thank you for watching or listening.